Today we are joined by Dr. María Teresa Solís to talk about CAP Wildlife Project. So please, Dr. Solís, can you introduce yourself, what your background is?
Thank you for the invitation. My name is María Teresa Solís Soto. I am medical doctor from Bolivia. I have training in public health and epidemiology, and also I am alumna of the PhD program in medical research and international health at the Center for International Health of the Ludwig Maximilian University. Currently, I am also responsible for the CIH-OH Target Competence Center at the local university in Bolivia, Universidad San Francisco Javier de Chuquisaca.
Thank you so much for your brief introduction. Could you please start with your presentation now?
On this occasion, I want to tell you about our CAP Study Wildlife Project, in which the CIH of the LMU participates together with 4 universities in Latin America: Universidad San Carlos de Guatemala in Guatemala, Universidad San Francisco Javier de Chuquisaca in Bolivia, Universidad de O'Higgins in Chile, and Universidad Federal do Paraná in Brazil. The project is financially supported by the fund of the BMZ through the International Alliance Against Health Risk in Wildlife Trade, and it is coordinated by the GIZ. Well, as you know, the environmental, human, and animals are interconnected. What affects one inevitably affects the other components. In this sense, the relation with wild animals has gained relevance since they have been the focus of the current pandemic, COVID-19, and also is the focus for future pandemics. So in relation with that, currently we face several challenges. On one hand, the impact of climate change is not only on the environment, it is also in the social and economic side, but also, on the other hand, the reduction of wildlife habitats due to deforestation, transformation in land use, urbanization, but also accelerated population growth, and the consumption and trade of wildlife put this interaction between animals and humans in risk. And it increased the probability of transmission of pathogens between species, generating new risk for new diseases. Actually, estimated that nearly 60% of the new diseases are from zoonotic origin, and most of these are related with wildlife. For that, it's necessary to do something. And it is important to try to reduce this risk to have the harmony between animals, environment, and humans. But to start doing something, it is essential to know some important issues. For example, what do people know about zoonotic diseases? What is the perceived risk of the communities in relation to this topic? What practice do we have that can damage the relation between animals, environment, and humans? And also, if we are willing to seek for solution. For that, and trying to answer these questions, we propose the project Knowledge, Attitude, and Practices towards the risk of zoonotic diseases, wildlife, and wildlife consumption in 4 countries in Latin America: Bolivia, Brazil, Chile, and Guatemala. We are considering analyzing differences and common grounds between urban, rural, and indigenous communities, but also we want to see difference in relation with age group, because this difference need to be also aborted with different intervention. In the project, we propose a 5-work package. The first 2 are related with the situational diagnosis. It includes a qualitative component when we are implementing questionnaires in representative samples of the communities. And also we are doing interview and focus group with the communities in order to know some barriers and facilitators to implement some programs. After that, we are working in work tables with authorities, organizations, and the community in order to analyze the problems identified and also prioritize this problem and look for a solution together. After that, we are going to design together with this group some intervention, and we are going to implement. And finally, in the last package, we are going to disseminate all the materials and the result of the project. This is important because our primary purpose of this project is create awareness, strength education, and co-construct strategies for behavioral change, respecting the culture and worldview of the communities. The project is still under development, but with some preliminary results. Communities have reported low knowledge and very little training on zoonotic diseases. Likewise, risky practice in handling or interacting with wild animals have been identified. And also, another interesting result is that there is little articulation between health sector, biodiversity conservation, and other sector, which is reflected in isolated strategies and little comprehensive vision of the program. On the other hand, it is observed that the communities recognize certain benefits of animals, but also fear in some aspects. Also, another important finding of the project is related with our research team, since it is an opportunity to promote interdisciplinary work and joint learning around a common theme, in this case, zoonotic diseases. I want to emphasize some contribution of the project. First of all, I want to highlight the community and participatory approach. This implies considering the needs of the communities, respect for their rights, and understanding their story, context, and dynamics. Likewise, with the project, we highlight the value of education as an engine of change, which can bring positive societal changes. Finally, the predisposition of the project team to learn from the communities and other disciplines has been very important. In this sense, we consider advancing towards the vision of One Health. It implies mobilizing sector and disciplines together with the communities at different levels, including authorities and general population, and together articulating collaboration, coordination, capacity building, and communication in favor of environmental, animal, and human well-being.
Thank you so much, Dr. Solís, for your great presentation and insight into your CAP Wildlife Project. And now we're gonna have a short question-answer session. How does your research contribute to the field of global health? Could you please explain that?
Yes, thank you, because I think the project aligns really well with the pandemic prevention, which is relevant to global health. A clear example of this impact has been COVID pandemic, which has shown us that no place can be isolated. So in that sense, we are considering the role of communities in reducing risk or adhering to the regulation and recommendation. For that reason, we propose CAP study in order to explore this knowledge, attitude, and practice, because that can be a facilitator for the adherence of this recommendation.
Thank you so much. Next question is, how can university alliances or collaborations can help you with your work?
I think that is really important because from the international or in general, the collaborations, we can create an alliance where we can exchange knowledge and experience. So in that part, the vision of different disciplines, different actors is relevant in order to try to seek solution more integral, because also the communities and other sector at local level can contribute to different visions that can try to look for better solutions.
Since you talked about local communities, so how do you disseminate your research findings to local communities or stakeholders in different regions of the world?
Yeah, in this project, we planned different dissemination channels. For one side is the academic dissemination that also is relevant because we can share the experience and the results and also advice for other teams in new ways to approach this topic. But also we consider dissemination at the local level with local actors because that is relevant in order to validate our results and also in order to try to look for some changes.
Definitely. Do you believe that university alliances such as UGloria can facilitate international research collaborations and academic exchanges?
Yeah, totally. Because I think with this kind of networks or alliance, we can be involved in more active way in this project and also sharing some experience and also some academic information. So I think to try to work together with different disciplines, areas, and in different parts of the world, it's important to look for a solution together in a better way.
To close the session, I would like to ask a last question. Can you describe a future research project that you're particularly excited about, and how will it contribute to the field of global health?
Yes, actually, we are just starting a new project that is related with the identification of antibiotics in food. And also, we are comparing results in different countries, in different continents. So it is Italy, Bolivia, Nepal, and Ghana. So our idea is to mix a first part of a lab analysis of food, but also a general component with population, with the survey, where we want to explore the knowledge also, and also some practice related to this. And with the results, we are planning to develop and implement an awareness campaign. So we think that the antibiotics resistance is a really huge topic that need to be aborted with the global vision. So I think that is really important for the global health also.
Thank you so much for your time, and it was great learning more about CAP wildlife and how it is important for global health as well.
Thank you very much for the invitation and for this space in order to exchange a little bit about this project.